this trial is being done in high-risk localized disease and locally advanced disease, prostate cancer. So these are high-risk patients, and some of the patients with N1 are also allowed on this trial. So these patients, the standard of care is upfront prostatectomy or a combination of radiation therapy plus 2 years of androgen deprivation therapy, i.e. LHRH agonist usually, combined with usually abiraterone. Now, the neoadjuvant therapy before prostatectomy is still considered investigational, and there are trials going on like the Proteus trial looking at neoadjuvant LHRH plus apalutamide, which is 6 months before and 6 months after prostatectomy. This is the way the Proteus trial is giving that regimen. Now, what we thought of doing in this trial was give a brief potent combination like Relugolix and Darolutamide. They're both oral drugs. It's an all oral regimen. So it's brief potent therapy, and we can, and then these patients go to prostatectomy. The hope was that with brief therapy followed by prostatectomy, we can achieve good outcomes without long-term 2 years of ADT like is given with radiation. And also, unlike the Proteus approach where it's 1 year of therapy overall, as with LHRH agonism plus apalutamide, in which case the castration lasts a lot longer than 1 year actually. The other novelty in this our trial is that the patients on Relugolix and Darolutamide should recover their testosterone promptly, within 2 to 3 months. We expect that to happen. So we should be able to get a post-op readout of PSA in the context of a normal testosterone, which you will not get if you give patients LHRH agonists, because that causes castration for a very long time after the last dose. So we feel that the post-op PSA nadir in the context of a normal testosterone can be used to inform adjuvant therapy, and we don't have to necessarily do pre and post intense therapy like the Proteus trial is doing. So it's kind of a novel paradigm. Men don't enjoy androgen deprivation therapy, of course, and so this kind of brief therapy while they're waiting for surgery, followed by surgery, and then using the post-op PSA to inform further adjuvant therapy, we think could be a nice new paradigm actually, and also a backbone to build on. In Relugolix's darolutamide trial is essentially a phase 1 trial. It's a safety and feasibility trial. So we have 10 patient lead-in, and then once we show the safety, we expand to 20 more patients. So the overall trial is a small 30-patient trial, and then hopefully we will be able to take this backbone further, combine other agents. We do have PK studies to rule out interactions and the PKs of these drugs. We don't expect a major interaction between Relugolix and darolutamide. I think that this regimen has potential for the future.